my name is CJ. I'm going to be your student nurse for today. I'm just going to go ahead and provide for privacy, and then hand hygiene. Need 30 seconds. And then your physician has ordered to do IV insertion and removal. It shouldn't take too long. I would say about 15 minutes, but if you have any questions in between, just let me know, okay? Okay, may I get your name and date of birth? Pierce Jonathan. Awesome. Date of birth is wrong, so I'm gonna get registration for this. And then registration.
Just a moment.
And do you have any allergies? Hydrocodone, Benadryl. And it says pineapple and penicillin over here. So I would get this changed. Yes. And it says allergic to hydrocodone and Benadryl, but this one says this. Awesome, thank you. This back. Just gonna get my supplies ready. And then, have you had a history of stroke, breast cancer, or have you had dialysis done before? Patient says no. Okay. Put this back in here. And then I'm assessing for skin integrity. It looks intact. And then patient has no tattoos as well. Then I'm gonna go ahead and put the tourniquet on. Assess for patient's vein. Okay, found the vein. Then I'm going to clean the site letting that dry, I'm gonna go ahead and prime this needle. Okay. Then I'm gonna put the tourniquet on. Alright, make sure that the bevel is up. Hold the skin taut. Insert 15 to 30 degrees. Click, move tourniquet. I got blood return. I would insert this. Okay, and I'm gonna go ahead and tape this site. And then I'm gonna push. Okay. And this would go in the sharps container. And then my needle in the sharps container as well. And then I would grab a new flourish. Apply the Tegaderm. And then I would tape this in here as well. And then I would clean this port over here. And then just the same. And then this would be inserted in here. Or, yeah. It's a new port. Why did I do that? Okay. Alright, and then I would dispose of everything. And then the physician is ordered to discharge the patient home and remove the IV site. And then I would have put my name and initials over here, so I would put my date, name, and then needle gauge size over here, and then I would remove my gloves, and then hand hygiene again for 20-30 seconds. the needle as well. This would have been clamped. Okay. And then the physician has ordered to discharge the patient home, so I would put on my gloves again. Tag, could I get a cotton ball, please? And I would just remove the site. Thank you. And then I would have had the saline flush in here and then clamp this part when I put it in earlier. Hold the site for at least 5 seconds. Tape it to the patient's arm. So we'll go in a sharps container. Okay. Is everything okay? Awesome. And then I would make sure that the patient is in a safe and comfortable position. I would make that the call light is within reach. I would lower the bed down as well. And then I would make sure that the bedside table is within reach as well.